Hello and welcome again to another episode of All Things Autism, where we come in and answer the most pressing questions you have about autism. And if your child has been diagnosed with autism, I'd love for you to join in and drop in your questions in the question box because we might just answer it in one of the upcoming episodes. If this is your first time joining us, I'm Dr. Lumfrundi. I'm a pediatrician and an integrative medicine provider. We started this last week where we talked about, is it speech delay or is my kid autistic? Now, if you missed that, I would love for you, we'll drop a link in the comment box where you can go in there and catch it because we really went in to distinguish the difference between a child who just has a speech delay versus a child where we need to look in further to see if there is that high risk of autism. And joining me back again today is Dr. Sree. Tell us who you are and then we get started.
Hi, Dr. Lumfrundi. Thank you for inviting me again today. It's an honor to be on your show again. So I'm Dr. Sree Ramakrishnan. I'm a board certified pediatrician and I'm also board certified in integrative medicine. I am currently practicing in Frisco, Texas, and most of my children that I see are chronic kids, not only autism, but we are also dealing with asthma, allergies, and other chronic diseases in children.
Awesome. Thank you for joining me again. As we know, the diagnosis, we're seeing more and more kids being diagnosed with autism, and it's such a huge spectrum, and it's a lot that comes with it. So today we're talking about, let's say we have that child who has now met the criteria for autism, and the mom is like, okay, now my kid has a diagnosis of autism, what next? Because that can come in with different kinds of emotions. I've seen parents who are in denial. I've seen parents who break down. I've seen parents who are angry. I've seen all kinds of emotions, which rightfully so, right? As humans, we want them to feel those emotions. But I would love for you to help us understand, how do you help your parents or your clients and your patients through this process?
Yes. Thank you for asking that question, Dr. Lam. I think, again, this is not taught we're not taught this in medical school. And I've been taking care of parents and patients going through those emotions in the past, 10, 15 years now. And I think the most important thing to remember is we just need to give parents permission to feel whatever they need to feel. Some of them, as you said, may be in a state of denial. I'm sensitive to these emotions because I usually, when I see like a screener question come back positive and I'm seeing a kid at high risk for autism, I do share my concerns. I say, hey, your child is at high risk for autism. And there is a little bit of nervousness on my end too, because I do not know how the parent is going to take it. I do not know how the word autism sounds to them. So sometimes I like to clarify that if I do feel that they look confused, I like to clarify that, what does this word autism mean to you? I believe that your child is at high risk for autism. And what does that word entail to you? It's a spectrum, as you said. It is not a disease, so we don't have a cure for autism. But at the same time, I want to understand what the parents' fears are. What are their assumptions? In their minds, it might be a highly intellectually disabled child who is developmentally delayed, maybe not even being verbal. They might have that imagination. But what I might be seeing is a child just needing some help with the social communication skills. But all of those can come under that term. So it is, I think, important to understand how do they interpret the word autism. And I do respect all of the feelings. I have gone through those feelings, with the parents. The first, maybe 10 years ago, when I would say, the word autism, I've had parents not come back to my clinic, so they might not show up. And I clearly remember this parent. So we had discussed, the child is at high risk, they could not accept. And so there was no intervention done. And it was maybe around 2 years of age. And I did see the child again 1.5 years later. That's how I realized, okay, there's a big gap here. And at that point, the child had made no progress. So then the parents realized, my child is 3 years old. They should be speaking something. And my child is not speaking, because they hear from parents, grandparents saying, oh, your child is just a late talker. Just like we had that conversation about late talkers and autism. Then, so that state of denial can be years. I don't know how long that's going to be. I want to help parents understand that early intervention is key. We want to get through those processes. We want to understand where they stand. Sometimes it's a feeling of relief that the parents feel. It's like they've gone to so many places, they knew something was wrong, and now they could understand what's truly going on with the child and get therapy services. So they have that feeling of relief that they go through. Sometimes it might be guilt, sometimes it might be anger. So there is a range of emotions the parents feel, and I'm there to support them, understand them, to navigate the process.
Absolutely, because once we understand and help them through, then we can start really helping the child, because ultimately we want to make sure we're giving the best to the kids.
That's very true. And I also clarify, we're not trying to label your child here. It is about understanding what your child's needs are and be able to provide the therapy services targeted to those needs. And I think having that clear communication and understanding, because in my end, I'm thinking early intervention is so important. So I don't want parents to be in that state of denial for a year or two and miss on those opportunities too. So again, clarifying that, hey, I'm not here to label your child. I'm here only to help your child get those early intervention and therapy services. So, a couple of years from now, your child has greater ability to attend school and, function better in life.
Absolutely. And so then we have some parents then who would go online, right? Oh my goodness, What is autism? What does this mean? And they will Google all night trying to find information, which is good. It's good to be informed. However, online, the internet does not know your child. The internet does not know your particular circumstances, which is why we want for you to see your child's provider or someone who has that information to help you through the process. So I would like to ask you, how do you then help your families in that first 90 days maybe of diagnosis?
Yes. So when we do the screeners as a pediatrician, first we're doing screener questions. We identify kids at high risk for a diagnosis of autism. Again, as a pediatrician, I do not diagnose autism, but I bring those risk factors to the forefront. And again, just like you said, once they hear the term, parents are Googling and I say, Dr. Google is not nice. And now it's ChatGPT. I think the personalized connection that the pediatrician or your clinician or your PCP might have with your child is going to be so much different than what you might get online for sure. You might get very specific information, but if you want to truly understand, you want to clarify those with your PCP. I highly discourage, going online first, but then I think it's very important for a parent to trust their provider. And I think that's, to me, is a game changer. I just want to share this. This reminds me of one of the sayings that one of my gurus had. He's no more, but he used to practice the Indian medicine and not like the allopathic medicine. He used to say, medications don't cure diseases. It is only the belief in the cure. So it is more about the relationship that you have with your practitioner that sometimes decides, the health of your child too. So I think it's very important to trust your provider and go with one that you trust. At this point, that's what I would say. If this is a professional that you would trust, I think go with them. So at least you have one person who can help you navigate through this, somebody an expert in that field, or at least has a lot more experience in that field. Autism, then the next step, we are going through those denial emotions with the parents, or maybe a relief, or maybe, anger. We don't know what those emotions are at this point, but then I'm trying to help them navigate through this. But the next important step is getting the diagnosis. The standardized reports are called ADOS-2 and the CORS-2 testing that is usually done by an experienced clinician. It's usually a licensed psychologist, or it can be done by the neurologist or a developmental pediatrician, and you will get a full diagnostic report. Now, the diagnostic report is important to get appropriate therapy services through your insurances. So I think the first step is getting that diagnostic report. So I would highly recommend first is getting a full diagnostic evaluation. The second is then bringing in all the practical aspects of once a diagnosis is completed, then all the practical aspects, that's your therapy referrals as well as your specialist referrals. Some of them can be initiated by the parents. Some of them you might need help with your pediatrician or your provider, your primary care provider, to help with those. As far as the referrals go, I would say age-based. Like, let's say your child is less than 3 years. It's very important to go through the ECI, the Early Childhood Intervention Services. If your child is more than 3 years, I would definitely contact the school ISD, because of the IDA, the Individual Disabilities Education Act. All of the preschools are required to provide those facilities, and you can request those. As a parent, you can request those. As a parent, you can self-refer to your preschool, educational services. Parents can just briefly, write an email or a letter saying that, these are the concerns that they have for their child and they would like further evaluation for their child. But if they're not able to, it's good to contact the pediatrician or your PCP to say like, hey, can you help me format a letter? Just a simple email that they can start off with. But the next part is the therapy services, right? You have ABA, speech, OT therapy services, and that you might need help with maybe navigating through the insurances and then, getting those referrals to your PCP. And of course, the final piece is getting the specialist referrals. Again, this might be very individualized for the patient. So, for example, most of them might need referral to an audiologist because they might have speech delay. They might need referral to a neurologist if they have maybe a seizure disorder, or they might have, some other disabilities which shows concern for seizures. Maybe they might need a referral to neurologist, or if they have high risk, they're high risk for any neurodevelopmental disabilities, they might need a referral to neurologist. They might need a referral to a geneticist, right? And they might need a referral to maybe a GI doctor or maybe an endocrinologist because they have growth concerns. Maybe they have nutritional concerns. And sometimes I have one kid who have 10 different specialists they might need referral to. I do see a lot of nutritional issues, so malnutrition is an important aspect there. So they might end up seeing a registered dietitian, nutritionist, and or they may also see a GI doctor too. So those are like common referrals that I do. Just segueing to your next question, like how does a 90 days look like? I think that's also another important question. I think I gave a brief overview about getting the diagnostic report, getting that referrals, and then getting those specialist referrals also. And I think another important point I want to share here is just stick to one trusted professional and maybe a few trusted resources, because again, you don't want to Google everything, right? For example, you might just want to go through the AAP website, the American Academy of Pediatric website, maybe, and the CDC website. But also there's another website I would highly recommend. It's called Autism Navigator. I've used it a lot. There is resources for both clinicians as well as resources for parents. There are other nonprofit organization resources too, which can provide you local resources. For example, like Autism Speaks, they can help with local resources. Hey, where do I find an ABA center, or where do I find like a place for a childcare, or maybe a developmental preschool? A lot of the local resources they might be able to help you with. So those are the online resources you want to go into rather than just Googling, and then you might have 10 different opinions from 10 different websites. So
yeah, that's a lot, right?
Yes.
I mean, 10 referrals. I'm thinking of myself as a parent. Now, other kids, and then you have to work. How do you help them sort through those referrals where it's just like, do I have to go to all of them at once, or are there certain ones that you recommend starting with? How do you help them through?
Yes. Again, this is kind of like a brief overview I can again do with the majority of the patients. So once they come to me back, I ask them, okay, I think the important thing for parents to understand is they have to establish a medical home. Once they, have a pediatrician, I do see them. That's why I think it's great to have an integrative medicine pediatrician, right? Because I can not only do as part of a PCP, but also help them through those various approaches. So first, when they come with the diagnostic report, I say, hey, you want to make an appointment with me every 2 months, right? Because there's so much to navigate. You're going to go through some confusing, things. And I want to help you through that process because it's only the start, right? So I have them actually make an appointment with me every 2 or 3 months. So they have like maybe 4 or 5 appointments throughout the year so that we can establish what I call the medical home where I can coordinate care for them. So that said, between the first and the second appointment, which is like maybe 3 months away, I give them like a homework to do. So that's your first 90 days, right? So in that first week, I help them, understand the report. Okay, you have this ADOS2 testing. Please go through that report, right? You want to understand where your child is. Sometimes it might tell you, okay, my kid is a level 1, a level 2, needs so much support. What adaptive skills that my child has, what are the learning abilities, what are the communication skills. So you want to understand the child. And as a parent, only a parent can understand their child the best. And that's why they're the best advocate for their child. I see hundreds of kids. It's very hard for me to truly go into the minute details. But as a parent, if you are the best one to understand all of those details, what is your adaptive functioning for my child? All of those will be in that diagnostic report. So you do want to read through the diagnostic report. It's not for the pediatrician to read only, it's for the parent to read through that report. Once, they have an idea about what's actually going on with the child, what are their aspects, what are their strengths, what are the things that needs to be worked on. Now they have a better understanding, right? So then focusing on, okay, what is the next step is the therapies for the child. So the next 1 or 2 weeks, I'm having them work through their insurances to start on those therapies, right? You want to have a lookout, okay, what therapies do I need to, start to work on? So make sure that they have ECI set up. Like as I said, less than 3 years, we want parents to contact ECI. More than 3 years, we want parents to contact the preschool and get that preschool special education services. Now this they can start right away. They don't need a diagnosis. They don't need any referrals. They can start off right away. And then call the insurance and understand what their benefits are. Like, what is my deductible? Who are the professionals who can, like, for example, the therapy centers who are in network with my insurance? Do they require like a prior authorization for any of the services? What are the visit limits? What are they deductible? They need to understand their insurance first. And again, as a medical provider, as a pediatrician, I do accept insurance, but there are thousands of plans out there. Not even my biller might be, familiar with a lot of those plans. We can only run through insurances for the visit that we have, but those are a little bit more, again, I think that's the work that needs to be done by, on the parents. And again, I think as parents, if they can share responsibilities, that would be great too. Like one parent, working on insurances and the other one looking into, okay, what therapy centers, what best, like understanding my child, what therapies would be more, focused to help my child, kind of getting those responsibilities shared also will help during that week. Then the 2nd to the 6th week, around 2 to 6 weeks, you probably want to start the evaluations, right? Okay, like we have the audiology evaluation to be completed. We want the speech evaluation to be completed for the communication. We want the OT evaluation for your sensory integration therapy maybe, or other life skills. We want the OT evaluation to be completed. We want the ABA evaluation to be completed, the applied behavior and analysis, or any other, behavior intervention that the parents are looking into, those evaluations completed or, looked into. And of course, setting up with either the ECI or the school, and sometimes you might have to work through the logistics of, okay, if I have an ABA as well as a school, how can I make sure that I'm able to get both services together, right? I want relationships with other students in the community, but also I want an ABA service for my child. So you want to get the logistics squared out during that 2 to 6 weeks. And then the next 6 weeks, like maybe I would say the 60 to, the 90 days is actually starting the therapy, getting that evaluation done. You probably would have picked up a right place. Okay, this is close to my home. This is a therapist that my child likes. I might like a home-based therapy. I don't want a, center-based therapy, or I might do better with the center-based therapy. Again, these are so individualized. As far as you have a reputable center that they go to where they have a good reputation on managing these kids, I think, and your insurances are a network, I think we should be good with most of the centers. A key thing, for example, if when choosing an ABA center, you might want to say, okay, do I want center-based? Do I want home-based? How are the therapists? How many BCBAs are there in the center? How many RBTs are there in the center? You probably want to understand those nuances once you start therapy too. So the next 60 to 90 is actually starting therapy, right? So again, when we start therapy, we want to focus on what is most important for the child. Okay, if speech is the most important, we want to definitely start speech therapy. We definitely want to start maybe any evidence-based interventions, as I said, ABA or any other evidence-based behavior intervention. Or maybe it's feeding therapy. We don't know for that child, right? So we want to just focus on starting the most important therapies for the child. Behavior is the most important issue. Okay, make sure that we have some behavior intervention started for the child too. So that 60 to 90 days is more about starting those therapies. And then simultaneously, you want to get those referrals working to, maybe getting into your geneticist or your neurologist or your GI doctor or your registered dietitian. You want to start that next step in that evaluation where, maybe the GI might find something different for the child, or maybe the nutritionist might find something different for the child, or the neurologist might find something. And that's going to be that next phase, where that I have that second appointment in that 3 months time frame, and we discuss, okay, these are the findings for your child. Let's go to this next step of what we need to do for your child from that 90 to 120 days, maybe.
Yeah, absolutely. Oh, this is amazing, because that 90-day, based on what you can really get to that point where you organize and get to the point where your child is getting the therapy in the 90 days. But that really requires you, firstly, really understanding your child, reading the reports is really important, because that will help you, especially when you're talking to your pediatrician or your caregiver, with the kind of questions to ask, right? About like what to help you get that understanding. And then also what I find too, it helps save a lot of time. Because if you're just going by what, everybody else is saying or what the internet is saying, it can be very distracting, where it's just like you start calling and like, oh, I want this one, I want that one, I want, so all over the place, instead of focusing again, what do the scores show? What does my insurance cover? What does my child need? Because I think ultimately that's what we're looking for. It's like your particular child, very different from every other child. This child at this time, at this moment, what does this child need? And we start there and just take it one step at a time.
Exactly. You're right. Yes. And I do face as a challenge where parents get distracted with so much information from maybe support groups or family and friends that, hey, I heard this is the best thing to do for your child. I heard it. Sometimes it becomes unfortunate where the kids are not getting the services that is most important to them.
So moving on now, we talked about the therapies, we talked about insurance, how to kind of help you through where we're getting the resources in a timely manner. What are the other things that a parent can do at home outside of the therapy, whether it's lifestyle or integrative wise?
The most important things, apart from navigating through all of those therapy resources, either it's ESTM or, there are other therapy resources that there is something called parent-led therapy that they can look into online, for example, and I can put those resources down there. There's something called Ruby therapy. There is something called floor time therapy. There is something called Fota Health that I can put those resources there where it is more parent-led. So they can do some interventions at home. They don't have to rely on a center or, they have guidance through those resources. And if parents have the time and resources to do that, they can do those interventions at home. Apart from that, the parent-led therapy that they could potentially do, you do want to focus on other aspects for the child. Right? It's to do it. And that's where I come in, like the integrative approach, where we're talking about lifestyle, we're talking about nutrition, where we are talking about help with medications or supplements or prescriptions for this child too. Now, I think the most common ones I come across is to do with the diet and nutrition. Maybe there could be a different topic another day. And as you know, kids can be very picky. They can have feeding issues. They have sensory issues. So diet and nutrition seems to be the most challenging. And once we take care of the nutritional concerns, I do see a big difference in these kids, and they are more prone for nutritional deficiencies too. So you want to correct those nutritional deficiencies too. So I think that is one integrative approach I focus a lot. I actually have a registered dietitian in the clinic who helps parents with the nutritional needs also, because we understand the issues with the feeding, the being picky eater, the sensory issues. So we have to navigate through all of those and come across a good diet plan, nutritional plan for the children. The second thing I deal with is sleep. The majority of the children can have issues with sleep, and that can also be tied with your gut health too. So if you have very poor gut health, like let's say they found that I'm not sure about the exact statistics, but more than 50 do have some gut related issues. It could be colitis that is causing behavioral issues, maybe causing sleep issues too. So you want to address all of those concerns. So maybe check with the constipation, make sure they're not constipated. Very simple. I see a lot of behavioral changes just by managing constipation, managing sleep, just with melatonin maybe, or maybe through sleep hygiene, or making sure through lifestyle interventions like eliminating or reducing screen time, making sure the child is having some amount of movement therapy like exercise therapy or play therapy. So all of those integrative approaches help me get a better success. I can give you an example. I had a parent who had gone to Panama for 2 stem cell therapies. And then they came to me and we did the integrative approach. Again, I call it the low hanging fruits, very basic ones. We want to take care of really basic ones here, just addressing their nutritional needs, correcting their nutritional deficiencies, and taking care of their gut health. Right? Again, just a constipation aspect, making sure, all of the sleep hygiene, all of those is taken care of. The parents told me that they found greater improvement in just doing those simple things than with the stem cell therapy. Right? So I think having the basic ones, taking care of this low hanging fruit is so important. Yeah, I think I can talk about the integrative approaches for hours together, but those are the basic ones that I come across and I help manage.
Thank you about that. I love that example you just gave, right?
Mm-hmm.
All the things we talked about. Sometimes, especially when you go online and they tell you this is this quick fix, if you do it and it's done, and without doing all the other things that help support your kid, it might just not work. So really going through and making sure you're getting the right resources and including the parent-led therapy you just talked about too, because even with all the centers, you still are there with your kid on weekends, right? On holidays and stuff. So you want to be able to have those tools, those resources that on weekends, the kid is not just on the screen all the time, but there's certain things you can do, certain routines you can put in place so that your kid is getting that consistent care throughout, even on weekends too.
Right. Yes.
All right. So how do you help? This has been a lot, but how do you help families protect their relationships?
That's a good question. It is definitely a lot of time and work and things to navigate through. It's very confusing as a medical professional to navigate through, what interventions are available, how to help the parents. I, as a professional, find it very confusing to navigate this area. Then I feel for the parents, if I'm so confused, how confused are they going to be? My experience also helps me with the intervention. So treating so many children over the past 10 years, what worked, what did not work, what challenges did so many of those parents face, how they handled it, so it gives me a better idea, a better perspective of managing them too. Now, I think the most important thing when we deal during the stressful times with the new diagnosis and the fear of the unknown, right, that is going through the parent's mind, is getting as much as support as possible through the community, through family and friends, through their community centers. Could be a church, it could be a nonprofit organization. We do have a nonprofit organization. It's called Thrive Kids Foundation. Goal here is to bring the community together, because I could feel those parents feel so lonely. They cannot even express their emotions to their family. Sometimes they don't share it with their own family and friends because they don't want to be stigmatized. So they are not sharing. Now I think the information is more. Maybe parents are able to get better help. But 5 years ago, it was much harder, I felt, for the parents, because I did see they were very close. And that's why I started the nonprofit. I wanted it to be a space for them to open up, maybe get together with other parents who are facing a similar situation. So bringing in the community together. So I think identifying yourself or being with a nonprofit organization or a community center, maybe a church or a temple that you go to who can help with those resources, or maybe through the family and friend resources. And then also at the same time, it could be, with grandparents or with your spouse or with your other children. Maybe your only kid, you might have other kids. How do we help with those relationships? I think sitting as a family, identifying what the needs are and helping, and that should be a real conversation, beginning of a conversation at that time where, okay, this is something we would like to handle as family. This is something I would like to take care of, shared responsibilities between the spouses, and also helping the siblings understand, what's going on with the child, because they might go through some emotions that they might not share, because parents are going through their own emotions and siblings might go through their own emotions. So I think sitting with the other children and, helping them understand what's going on with their sister or with their brother or sister kind of helps break up some tension and helps the family grow together. But I've seen wonderful things happen. I've seen some of the siblings, they are so much advanced emotionally in taking care of their sister or brother. And as parents, I see so much love come forth. I think having a neurodivergent child brings forth challenges, but also it instigates so much love and affection and bonding in the family. If you're looking at the other way, I do see parents bond so much. I see, and I'm amazed. I feel like they should be my role model as parents. So the amount of patience they have, the amount of love that they have for the child, it does bring forth so much of those positive emotions. It's an individual journey for all of them, but I do see a lot of amazing things happen with the siblings and the parents. I admire them a lot. I'm like, oh, how are they doing this?
Yes, absolutely. So what I'm hearing is lean into the community, right?
Yes.
Lean into find your tribe and really lean in, because it's difficult. But with the right people or with your people around you, it can be an amazing process, right? Because and one of the reasons I asked this particular question is because I've seen a lot of families who go in isolation, where they don't want to go anywhere. They can't go to the grocery store. They can't take their kids to church. They can't go anywhere.
So
just
true.
Because everyone is looking at my kid. Oh, they're making comments on it. So it can be, if you don't really not pay attention to it, be a very isolating process. But there are communities, there are foundations, there are things that are out there, and there are people that are out there who are going through the same process, who understand and who see you and see your kids. So lean into the community, even the siblings, like you said. I've seen amazing siblings who will come in there and they've learned how to communicate with the kids, to the point where I had a kid one time just like, no, this is how. I mean, she was directing me how to communicate with the younger brother, because this is how they like it and stuff. So even the siblings are a part of it. So sometimes you leave those siblings out. They're a part of it. If you have other kids, it's the team, it's teamwork. Yeah. And one last question. I know you brought in you brought in the word neurodivergent kid. What do you mean by that? And what would you want a parent who has this diagnosis? What's the one thing you want to leave a parent with?
The most important thing to remember is autism is not a disease. So there is no cure, but at the same time, understanding that it is information that you have about your child. And that's why I like to use the term neurodivergent. So we call neurotypical, where your communication, your learning, your connection, we might say is typical, but neurodivergent is also okay. It's normal, right? So just a deviation from the norm, where we have a lot of people are this way and somebody is doing something differently does not mean that they're not normal. It could be they are normal. So neurodivergent is a term I like because it helps us understand that we are having a child who is communicating differently, who is learning differently, and who is connecting differently. It doesn't mean that is not normal. It could be they are normal. So
yeah. And it's an opportunity to grow and learn how to communicate, like we just talked about.
Yeah, exactly. So I think now there is a neurodivergent alliance. There are people who understand that they are neurodivergent. As they get older, they do understand. I have doctors who are neurodivergent, right? So their learning is different. The communication, it doesn't mean that they cannot function well, right? It is how the thinking and processing is just different. We just have to understand those differences and learn to live together and love each other.
Absolutely. Well, thank you. Thank you. This has been a lot of information, and I hope you all found this helpful and giving you direction on how to navigate through this process, and also giving you hope that it's the same child. We're just learning how to connect in a different way. Thank you again for joining me. We're going to come back again next time. And next time we're going to dig more in. We'll take a deeper dive into the integrative process. We'll start again with the nutrition, the gut health, and all things autism. So don't forget to like and subscribe. Leave your comments in the comment box, and we'll see you next time.
Thank you, Dr. Friendly. Thank you. Bye-bye.